Hi, I'm Dashiell Meier, and I'm an advocate for people with Down syndrome and other disabilities. I was invited to speak at the United Nations headquarters in New York by Down Syndrome International for the 13th World Down Syndrome Day Conference. I loved it. I got to meet people from different countries from around the world. On the first day, I was on a panel. I talked about what healthcare providers should know about people with Down syndrome. Another good example of what doctors should do is to treat people with Down syndrome the age they are. I mean, like, this is major. Like, I'm tired of being talked down to like a 4-year-old. I mean, I'm 20 years old right now, and it's about time our voices were heard. On the second day of the conference, I spoke in the United Nations trusteeship chambers, one of the largest, most prestigious rooms. When I got to the United Nations building, it was very beautiful. The room had a huge screen and many seats. Each seat has a device that you can put on your ear and choose what language you want. It was amazing to be in a room where many important world events have been discussed. I was pretty nervous because it was my first time speaking to the whole world. That in itself is a bit daunting when you think about it. So I took several deep breaths and told myself that this is just like I practiced. My speech went great. I made a lot of friends from all over the world. Over 20 countries participated in this conference. I felt proud of myself that I really stepped up to my expectations. I feel like I did something important.
Dashiell is a storyteller, filmmaker, college student, athlete, and advocate for people with disabilities. He will be talking about treating everyone fairly and with respect. Take it away, Dashiell.
Thank you so much. Thank you. Hi guys, I'm Dashiell Meier, and I'm deeply honored to be here today to speak to all of you. I am a college student, athlete, and advocate for people with disabilities. I live in the San Jose, San Francisco Bay Area in California. I'm a rising filmmaker, and I want to feature people with disabilities and their stories in my films. I first learned about health equity as a health messenger with Special Olympics. I talk with medical and dental students so they can learn how to work with people with trisomy 21 and other intellectual disabilities. Next slide. As people with Down syndrome, we face many challenges when it comes to health. One issue is that doctors sometimes don't treat us because they assume that our symptoms are just Down syndrome. When I was about a year old, my mom noticed that I stopped hearing. I didn't respond to my name anymore. I didn't blink when she clapped next to my ear. When she called the doctor's office, she was told that I couldn't have an appointment because it was just Down syndrome. The nurse told her that babies with trisomy 21 had slower processing speeds, so I wasn't responding to noises as quickly as a typical baby. My mom kept calling, trying to get an appointment, but they told her that she shouldn't expect me to be like my older sister. And boy, that is a pain. Finally, I saw a doctor when my ears started bleeding. Yeah, it was a lot. I had tumors in my eardrums that completely blocked my ears. I couldn't hear at all. When I had surgery to remove them, I could hear again. Without that surgery, I probably wouldn't be here to speak to all of you today. Next slide. There were other times doctors told my parents that my symptoms were just Down syndrome. But I had good experiences with doctors as well. I am lucky to have many doctors who truly care about me, like my pediatrician, Dr. Fong, who treats me with respect. When I became an adult, he took the time to make sure that my new doctor treated me with respect and cared about me as well. Talk about a win-win. If people don't know us personally, they may have ideas about us based on old stereotypes. I researched the history of Down syndrome and disabilities for a school project and a documentary I am making. In 1866, Dr. Langdon Down identified trisomy 21. Since there was no cure, it became a problem to solve. Societies have done this through eugenics. Putting us into asylums and separating us from the rest of society. And we had enough. It's time to change. The idea that people with Down syndrome do not have worthwhile lives makes it easier for society to treat us poorly. Today, we still see the ableism when we are told that our symptoms are just Down syndrome. This isn't fair. When you see people with Down syndrome, see us as people, not our disability. Our disability doesn't define who we are. Understand us for who we are. Don't just assume things about us before getting to know us. We deserve to have our symptoms treated. We deserve to be treated with respect by people who care about us and our lives. We can come together to be more inclusive and improve for the future by meeting the health needs of people with disabilities. People with Down syndrome need help. When other people start to realize that, then a lot can change. Think about how far we have came. Why not start now? All of our lives are worthwhile. All of us are worthy of respect. But most importantly, we are not just Down syndrome. Thank you so much.
Okay, well, thank you, Dashiell. That was so very powerful.